This is Tom Bernanke, and today I'm talking about vertical nail ridges. This could be a sign of an injury, but it can be much more serious issues. We're going to go over all those, as well as the top 10 home remedies, and we're starting now. So what are the most common causes of ridges in your nails? Certain health conditions and nutrient deficiencies can cause ridges, dents, or lines in your nails. Common causes of vertical nail ridges include, number one, normal aging. This can happen a lot to people and it means nothing. As you're 60, 70, 80, 90, this can definitely happen. Your nails get thinner, more dehydrated, and sometimes it's just nothing really at all, or it may be an undiagnosed problem that's not really affecting you. Skin conditions. It's possible to have very dry skin or eczema. Now, eczema is so common. This is just irritation of your skin. So for example, I had a patient who's a dishwasher or someone who sweats on their feet, and just that water use can dehydrate the nail. All those natural oils come off there. It's harsh in Michigan in the winter. It's cold. Your skin can get damaged, swollen, irritated. That can dehydrate and crack your nails. Thyroid disease. If you have hypothyroidism, you may have thick, brittle nails with vertical ridges. Your nails may also crumble or break easily. They may look more rounded and your fingertip may be puffy. Thyroid is a hormone in your neck. It creates a hormone that essentially can help you adapt to temperature. It can give you energy. So if you have low thyroid hormone, then you're tired, you're fatigued, you have a hard time adjusting to cold temperatures. So this may be a sign. What about horizontal ridges, not just vertical ridges? These are something called the Bose line. This is different. This is when something interrupts your nail growth, and possible common causes include chemotherapy. If you've had chemotherapy, your nail matrix or your stem cells stop growing the nail while you're receiving treatment. If you jam your nail, that jamming of the nail can impact the root. It essentially gets bruised and the stem cells stop growing new nail. A common one is peripheral vascular disease. This is when the blood flow from your heart down to your toes is decreased. This is something I see a lot, and statistically, over the age of 18, over 50% of people will develop it throughout their lifetime. One of the most common causes that I see is actually poor blood flow down to the feet. Peripheral vascular disease is so common in so many people, and it's only getting worse. And I'm talking when you're 50, 60, 70, 80. This is something you should start thinking about, because if it's not getting down to your toes, your nail matrix can't grow the nail properly because it's not nourished properly. This can definitely lead to ridges and is one of the most common causes I see. Now, most young, healthy people will not have arterial disease problem, but as you start getting older, your 50s, your 60s, your 70s, and further, this is something you have to start looking at. I palpate these pulses to see if you can actually feel that pulse. If it's kind of flat, you want to check the capillary refill time. So do your toes refill. It should be less than 3 seconds. If it's not, I can use a computer to essentially check the waveform and see if it's getting down to your toes, or you can do what's called an arterial brachial index. That's essentially putting the cuff around your arm and your foot. The ratio should be pretty similar, but if there's a lot less pressure down to your feet, then potentially that's something you need to address. So this is something very important in the office, and nail science can be one of the biggest changes that happen. And then at that point, you can actually see if there's narrowing or blockages. If you have any of these problems, it's very important you get checked out. That's probably the number one cause I see of all these nail problems in older people in the second part of their life. Severe illness with high fever, such as COVID, measles, pneumonia, severe flu, severe illness can do it. Essentially, your body doesn't have the nutrition or resources to send to your nail matrix, so they just kind of shut down for a little while. This is the nail anatomy. The nail matrix is the stem cells that grow the nail. If the nail plate is jammed back into the nail matrix, like this toe injury, you could have bleeding, and the nail matrix actually gets injured. The stem cells take months or longer to recover. And sometimes I have some patients who constantly injure their toes by wearing tight shoes, too small of shoes, and there's always blood underneath their toenail, and that nail matrix just becomes damaged. So you develop horizontal lines and vertical lines growing. What about vitamin or mineral deficiencies? These are more common than people think. Certain nutritional deficiencies can cause changes to your nails. For example, a zinc deficiency can cause Bose lines or white spots on your nails. A study in Japan actually found that 34.8 to 45.8 people have a deficiency rate. It gets higher as you get older. You can easily supplement this in a daily multivitamin, but nail conditions cause white spots, brittle nails, vertical ridges, slow growth, abnormal shapes, so this can actually be a reasonably common consideration. Iron deficiency, which is very common, can cause vertical nail ridges with something called Melonychia, which is called spoon nails. Spoon nails have a depression in the middle, like a spoon in the center of your nail, like it was scooped out. You may be able to hold a drop of water in your nail, potentially even. That's called spoon nails. So if you have spoon nails, think about iron deficiency. Iron deficiency is one of the most common deficiencies. Most people should be getting 10 to 15 milligrams per day, but 31.2% of women and 17.5% of men worldwide are deficient. This can lead to Melonychia, which is kind of the brittle nails, curved nails, ridge nails, and pale nail beds are common. There are a lot of different nail conditions. Brittle nails are very common. When I see this, I think, how's the health? Do they have diabetes, blood flow problems? Are they dehydrated? Are they washing their nails a lot? Do they potentially need to moisturize these? There's a lot of different causes of brittle nails. Yellow nails. This is usually poor blood flow to the nail. There's usually fungus, bacteria. It's usually detached. There's usually crust and callus and thick, dry skin underneath it. White spots. Most commonly, that's damage or nail polish remover. That acetone from the nail polish remover can cause a lot of issues and dehydrate the top of the nail. Vertical lines, that could be vitamin deficiencies, blood flow problems, brittle, dehydrated nails that lead to cracks. Bose lines, this is the horizontal nail lines. That makes me think of health issues. Like, hey, did this person have health issues like the flu? Is there blood flow issues? Now, a dark streak could be melanoma. That means potentially skin cancer, especially if it's going into the skin and the nail surrounding the skin. But a lot of times that could just be dry blood as well. For white vertical lines, these are usually more harmless causes, and the home remedies we talk about here should be very effective. Essentially, nail care, filing it down, moisturizing it properly, identifying vitamin deficiencies, keeping it warm, and preventing chemical damage or environmental damage should do the trick. Splitting nails or vertical splits like this are also very common. This is almost always traumatic unless something like really obvious is growing underneath the nails. This can be psoriasis as well, but essentially prevent dehydration, environmental damage, stop using acetone, which is in your nail polish remover. Get something more gentle like Dr. Remedy brand. I linked some of those down below, but there's a lot of options to prevent this permanently. And then we'll go over the remedies. They're very successful for this. Now, look at these black lines. All three of these extend into the root of the nail or the skin. This is called a Hutchinson sign. This is where you want to become concerned. This can be a melanoma, which is probably the most dangerous type of skin cancer. What I would do in this case is, unfortunately, you have to detach the nail and biopsy the skin underneath it. A lot of the times this could just be dry blood, but you don't want to take a chance. This is actually what got Bob Marley. He thought he had a soccer injury to his big toenail, but it was really melanoma, and that's why he passed away. And even though I probably gave people some heart attacks in the previous slide, the good news is almost 20% of people, especially certain cultures like Asian populations or African American populations, have Melonychia very commonly. It's almost in 20% of people. And toenail fungus, a lot of the times too. Look at that. Toenail fungus looks like a black streak. You could have fungus that looks like a black streak. You can have yellow toenail discoloration. But take a look. Neither of these are going into the skin. So while melanoma is possible, it's a little bit more rare. And you can see in these images, it extends into the skin and it's clearly thick and it just has a very aggressive nature upon it. It's not a faint black line. I did a lot of videos about horizontal nail ridges, black streaks, white lines, white nails, all the nail problems. I link those below, including the top 15 skin problems on your hands, on your feet. I review all of those. If you have any other skin problems or issues, check those out below. What are the remedies and the treatment for your nail ridges and nail problems? So first, a lot of these things work great and these treatments work great. But if you think you have a medical illness, if something's worrying you, get checked out by your doctor for sure. So getting worked up for something like thyroid disease may be very beneficial, or getting blood tests to check for mineral or vitamin deficiencies. And the thing to know is it can take 6+ months for your fingernails to grow. And a fun fact is, in the summer, your nails grow 50% faster than in the winter, especially here in Michigan where it's cold. Your toenails grow a lot slower than your fingernails. The way I think about it is your hands are closer to your heart, so they're closer to nutrition than your feet are. So the feet don't get as much blood pressure and circulation and nutrition. I always tell patients it takes about 3 months or 4 months to grow the length of a grain of a rice. That's a good way to think about how long it takes to regrow a nail. Another quick point is, if it's just one fingernail, it's most likely trauma. You probably jammed it, you probably injured it, but if it's all your fingernails or like one hand, that's more likely that you could have vascular disease to one hand or a nerve problem to one hand. Or if it's all your fingers, that's more likely to be a systemic disease. So here are the top 10 home remedies for your vertical nail ridges. If they're ugly, if they're catching on stuff, if they're bothering you, let's count down from the least practical to the most practical treatments. Number 10, reduce the stress and damage to your fingers. So for example, if you're washing dishes, if you're on your feet and you have a lot of pressure on your toes, if you're standing 12 to 14 hours a day at a factory, that's going to damage your nails. You're going to get splitting, you're going to get cracking. Potentially wear some gloves, get some insoles, get some good shoes to take pressure off your fingers, your toes. That generally does the trick for the majority of my patients. That works extremely well. Number 9, wear gloves in cold weather. So if you're wet, if you're cold, the weather can damage the brittleness of your nails. So essentially you have oil on your skin and your fingernails that protect it. But if that dries out, then the water leaves the proteins in your fingernails and that can dehydrate and crack them. So the key is not getting them wet necessarily, but protecting them with oils and protecting them with gloves so that the cold's not penetrating them. And just because I feel guilty if I don't, this great company, Nebron, sent me some gloves to try out. It's cold here in Michigan. These are heated gloves. Essentially, you plug them into a USB and they have enough heating for like 8 hours or so. I've used them in the Michigan winter. They're very well reviewed. I like them so far. I'm going to keep using them. If they don't work, I'm going to let you know in my full review, but so far they're working great. If you have Raynaud's disease or cracking in your fingers, if you have cold in your fingers that's not adjusting, check out this brand. It's linked below. Number 8, avoid artificial nails and harsh polishes. These can further damage the nail bed. There's something called keratin granulations, and what that is, if you take nail polish remover, which has acetone, which is a harsh chemical in it, it dehydrates and cracks the top of your nail. There's other brands, and I link some below, where you can get oils and tea tree oil, for example, in it. It'll still remove your polish. It's a couple bucks more, but it will remove that polish without dehydrating your nail. That's probably the way to go, even though it is a couple bucks more. Number 7, increase the circulation to your hands. Get the blood flowing. So there's a couple of ways to do this. In the wintertime, your blood vessels contract. So keeping them warm, massaging. There's hand massagers out there. There's different types of devices. But what can do it really well too is, especially when you're going out in the winter, you can grab some oil and massage it into your nails, into your skin. That will provide that external layer of protection. So regularly massaging your nails and cuticles with a nourishing oil or cream can stimulate blood flow and circulation to the area. This can promote healthier nail growth. Number 6, biotin supplements. Biotin is a B vitamin. It is known for its role in improving nail strength. This is put in a lot of creams now. It strengthens the keratin in your hair, strengthens the keratin in your fingertips and your nails. Biotin is always mentioned as a supplement for hair and nail growth, but realistically, no one's really deficient. It's rare. And supplementation is not necessarily recommended. I would say just take a daily multivitamin. That should be enough biotin, but the studies don't really support separate dosages for the average person unless you have a severe deficiency. Number 5, avoid harsh chemicals. So we talked about the nail polish remover, but also chemicals found in cleaning agents, dishwashers. If your soap, especially after COVID, washing your hands so much that it's going to dehydrate your nails, using gloves while doing household chores involving chemicals can be very effective. Number 4, gentle nail care. Avoid excessive picking, scratching of your nails. Use a gentle file, clippers, smoothers. This can be extremely effective. 3, proper hydration. Drinking plenty of water is crucial for maintaining overall health, including the health of your nails. Hydration helps in keeping the nails flexible and resilient. This is different than putting water on the external side. It's drinking it in your body so that your blood flow nourishes it from underneath. Number 2, a balanced diet. Eating a balanced diet in vitamins and minerals is essential. These days, our food is more processed than ever. We're lacking high protein, we're lacking biotin. So a great diet is a high protein diet. We want about 0.8 grams per pound. So if you weigh 200 pounds, you want to be getting about 160 grams of protein per day. If you're getting less, your nails might not grow the way they should. You also want biotin, found in eggs, almonds, whole grains. Omega-3s are great. These are found in fish, flaxseed oils, walnuts, other types of nuts, and they can be very beneficial for your nail health. And then, number 1, moisturize your nails. So this is really the key. I kind of mentioned stimulating that blood flow, but this is now getting specific creams. What I always tell people is the thicker the cream, the better it is for your fingers, for your toes. Lotions are water-based and they're better for your face. They're better for your thin skin, like the back of your hand, but for your fingernails, you want something thicker. Even like beeswax, like Burt's Beeswax, thicker creams can work extremely well. Oils like coconut oil, vitamin E oils are very popular. Split nail like this is almost always dehydration and exposure to water. What I always do is start by using a nail file. File that down, clip the distal part or the furthest part of the nail so it doesn't get caught. And essentially you can do 2 things. You can grab a thick wax and put it on there, or there are specific nail glues or lacquers. So there's prescription ones that are both antifungal and antibacterial, like Penlac that I use. That's an easy, quick prescription. So if you're in Michigan, I can write that for you. Otherwise, putting like a nail glue or potentially like Burt's Beeswax or something like that does the trick almost every single time. If you have a concerning dark line that extends into your skin, definitely go see your foot doctor. Like myself, if you're in Michigan, or your dermatologist or primary care doctor, get a biopsy just to be safe. It's probably just Melonychia, which is common, but if it extends into the skin, it could be a melanoma, especially if it's changing, bleeding, or cracking, or having any issues. But the good news is it's probably Melonychia, and it's very common in people. But you could also have toenail fungus. That's something you want to get ahead of. Check out my toenail fungus videos as well. I have a video that goes over all the best creams for thick, dry skin, for thick, dry nails. I go over that below. But also check out horizontal nail lines, black lines on your nails, wounds underneath your nails, cancers under your nails. Check that out below.